Let's go ahead and introduce our next presenter. It's a real pleasure to be able to introduce Melanie Menear. She's a correctional health nurse and contract monitor for Clackamas County Jail. Almost 2 full decades of experience in healthcare, specializing in SUD treatment and mental health care in carceral settings. Let's give a warm welcome to Melanie. Melanie, it's all yours, my friend.
All right. So thank you everyone for joining us. Thank you, Myque, for those kind words at the end of your presentation. I really appreciate it. As Paul said, I have a ton of experience in healthcare. I started in the hospital and about, I don't know, almost 10 years ago now, eight and a half, transitioned into correctional healthcare. And I can tell you, I absolutely love working with this population for so many different reasons. But primarily, I love the ability to see those individuals who come through our facilities on a regular basis, multiple times per month or per year, finally get things together and do better for themselves in the community. And that is absolutely rewarding. And it's something you don't get necessarily in the hospital setting. So that is why I do the work that I do. I am going to build on what Myque has shared with us. Myque talked a little bit about the things that we offer in our facilities, the different level of providers, nurses, our mental health professionals, our dental care. But what I want to elaborate on is, for the most part, all of these individuals have specific additional training working with corrections. They may not have additional training through their schooling or their licensure, but here in the correctional world, we have additional training that these individuals will go through on a daily basis. And it's important to us to maintain our professional ability to care for individuals who are often difficult to deal with and don't necessarily want or appreciate what we're trying to do for them. So there are additional trainings that individuals will go through. Our dentists probably appreciate the training the most, as they are in very close contact with individuals who are very unhappy about being in the facility, while they're grateful for the care that they're being provided, because this is care they may not have chosen to seek outside of the facility. It is a very intimate setting in a dental office, regardless of what your environmental surrounding is. And to be face to face with somebody who is having a dental issue, who is in handcuffs and shackles because maybe they have been a behavior problem for us, tends to get tends to make people uncomfortable. And so we provide additional training to our staff so that they are able to better manage what that situation looks like for them. It's the same for our mental health professionals. While mental health professionals outside of the jail are doing a ton of individual one-on-one counseling and have private settings where they can see individuals, while we maintain privacy the best that we can in a correctional facility, understand that our primary concern within a jail is safety and security. So we have deputies who accompany us on most everything that we do, who chaperone a lot of the things that we do. And without them, we couldn't do our job well. They are making sure that we are safe. They are making sure our patients are safe. And because of that, we may not have the same level of privacy that you would have in a doctor's office setting. There are some things that we do maintain strict privacy for if we are doing genital exams or something that requires a strictly male or strictly female escort. We do our best to maintain those things, but things like mental health evaluations or crisis management may not always happen behind a closed door. Those things may happen behind a semi-closed door or in a hallway or in a holding cell in our court services area. And so we adapt our practice model to accommodate our environment and the clients that we're serving. We talked a little bit about length of stay. Myque really kind of hit on a good topic for length of stay because it is ever changing. On the screen, I tried to drop some common things that we see. Every jail is different depending on your parole and probation divisions, the particular crimes that people are committing, your public defender's office or your district attorney's office. All of those things impact the length of stay in the jail. For the most part, a good rule of thumb, our parole and probation violations typically spend between 10 and 30 days in the jail. If you are accused of committing a misdemeanor crime, you could spend 7 to 14 days in some facilities, and you can spend as much as 30 days in other facilities. And then for felony crimes, including our Measure 11 crimes, which there's a box on the screen to describe what Measure 11 looks like, people are typically spending between 90 days and an undetermined length of years. All of that is based on the crime and the legal process. So in the beginning stages of the legal process up to the trial and the sentencing, we call that pre-adjudication. And that process can take a very long time. It depends on the severity of the crime. It depends on the defense counsel. It depends on the DA. So there are a number of things that can affect that. And because of that, everything we do is really geared toward those individuals who are staying less than 30 days, because those individuals make up 90% of our population. The felony crimes, the Measure 11 crimes really make up a very small percentage of most of the jail's populations. And so when we build programs or we expand programs, we are primarily focused on those people who are less than 30 days. They are the fastest turnaround. They require sometimes the most pre-work for a release or a transition plan. It's really important to note that not all of the services that we talk about here are available in all the jails. So for the next couple of slides, you are going to see that it's not available in all the jails. And there are a number of different factors that we're going to talk about in just a minute. But specifically to dental care, most jails have a very limited number of hours for dental care and dental staff. As primary care providers, you understand the lack of available services in some of our smaller counties, some of our more rural counties. Well, it's the same with dental care. And even in some of our larger counties, for us, Deschutes County, Washington County, Multnomah County, our access to dental care is still quite limited. It's not a lucrative business when you're working dental care in jail. Many of us have providers that are not full-time, and so that can be challenging, especially when we see a population of people with very, very poor oral health to begin with. And if you know anything about dental care, you know where the importance of dental care comes in with chronic disease management, like heart disease and diabetes. And so when we get dental care, and for those of us that have it, it's a very special thing for us. Primarily, our dentists focus on infections and extractions. A lot of that has to do with the limited number of hours or the limited access to staff. But for some of our smaller jails, some of our rural counties, there is a process where we can, the jails, where we as the jails can address the courts and ask for the individual to be furloughed or granted a temporary release to attend a dental visit. Now, those types of releases do require the individual to return to jail. So if the individual has a history of not returning to court, there's a good chance they may not get furloughed for that service. And then we as jails have to figure out what exactly are we going to do for that individual in the meantime. So dental care can be pretty complicated, and unfortunately, it's not available in all facilities. For medical care, your jails primarily in the I-5 corridor are your largest facilities, with the exception of Deschutes County on the other side of the range. Multnomah County is our largest jail facility, and then beyond Multnomah County, you have Washington, Clackamas, Lane, and Marion are right up there. Those 5 jails, not Multnomah County, are roughly 600 beds or less per capita in the county. So if you think about Clackamas County is both an urban and a rural county. We are also somewhat metro to the Portland area. We have about 600,000 residents across the county, and our jail holds 500 people. So having said that, one of the things that we struggle with in jails is that our services are taxpayer funded, regardless of whether you are a county integrated health system with your jail or a private contractor working for the jail to provide a healthcare services. Everything we do is taxpayer funded. So for your counties that have a smaller tax base, you are going to see limited access to medical care or dental care or substance use treatment or mental health care within the jail itself. It also means that you are going to see medical staff who have limited hours per day, per week, or per month. There are some jails that only have a nurse in their facility once a week for 2 to 4 hours, really just to manage orders for medications and then give orders to law enforcement officers about how to medicate people. It's the same with our medical providers. Those jails who have a very small tax base and a very limited medical care model also have very limited access to providers. Sometimes our medical directors are employed directly by the facility or by a health contractor, or those medical providers are partnered with county or community partners to provide that care in the jail setting. Because we have jails that don't have 24-hour medical care, many of our jails have set policies for emergency response, medication administration, crisis management. So think of, Myque talked about, we essentially are a self-contained city. We provide everything for an individual while they're with us, and we are their access to food and clothing and shelter and medical care. So if we take away the licensed individuals to provide medical care, we have to have a mechanism for training and educating our law enforcement officers who manage the jail's facilities on how to do those things in our place. For the most part, nurses run, I won't say run, they guide a lot of the care that happens in a correctional facility. elaborating on the lack of medical providers, some of us have full-time nurse practitioners and some of us have part-time nurse practitioners. Some of us have part-time medical doctors. Some of us don't have medical doctors at all, since nurse practitioners can function without the oversight of a medical doctor. So our nurses really guide most of the things that we do. They are responsible for when an individual comes into the facility, all the way until they release. We are looking at their substance abuse history, their mental health history, their acute disease history. So things like hypertension, diabetes, heart failure, liver disease, kidney disease. Do they have any additional medication needs? We, as nurses, handle most of the general sick complaints that happen with our facility, remembering we're a self-contained city. So if you were, as a free individual, not incarcerated, if you wanted Tylenol or ibuprofen, there is a process that you must follow to get Tylenol or ibuprofen in the correctional facility. You cannot just leave and go out to Walgreens or Rite Aid and pick up a bottle of Tylenol or ibuprofen. Here in the correctional facility, there's a process. You have to order Tylenol or ibuprofen on commissary if you don't get it from the medical staff. If you order it on commissary, it could be 10 days before it arrives. So there are some very specific nuances. And then the nurses are the primary response for emergency services. If you have a medical emergency in the jail facility, for most of the facilities across the state, it is either a corrections officer or a nurse, or a corrections officer and nurse team that treat you during your medical emergency or provide the care that you're going to need. Our providers are typically focused on getting medication started. They're focused on the follow-up and stabilization for individuals who do have chronic disease management that occurs in the jail. Our providers are also our primary initial referral source for specialty care like cardiology, neurology, and OBGYN services. At this moment in time, Multnomah County is the only county that provides OBGYN services to their incarcerated individuals in the jail. For the rest of us, our population of pregnant females is pretty low. We don't have enough of a population to support that type of service in our facility and keep the residents, the OBGYN residents, to keep them busy for clinical rotation. So we do not have that as an in-house service, but that means that we have to refer those individuals to you on the outside. And so think about that as how it occurs for you, where we are sending an individual with one or two law enforcement officers. They are handcuffed, they are shackled, they are riding in the back of a police car. They come into your clinic, they're presenting to your front desk in your waiting room with all of your patients that are also waiting for that day. And think about the stigma that that presents, not only for the people in the waiting room, but the individual being transported and treated, the officers that are doing the transport, your clinic staff, your clinic providers who we won't let an individual out of our sight. And so everything that you need to do for that individual, including surgery, happens with an officer standby. And then, of course, substance use treatment or medications for opiate use disorder, or any medication for substance use disorder. Our providers are focused on making sure those things continue with the right prescriptions and the right access to care. Mental health care also not available in all facilities. A lot of what our mental health team does is crisis management. When you think about an individual who is here for 14 days, sometimes that is all we can provide to them. When you're one licensed social worker or licensed professional counselor or one psychiatric nurse practitioner, and your patient volume is the volume of the facility today, which for Clackamas County right now, it's 335 people. So if you are a psych nurse practitioner, or you are at LCSW, today's census is 335 people, and those 335 people fall under you as the one individual. So there's a lot of crisis management that happens within the jail facility. Our mental health providers do manage the majority of our mental health medications when this service is available. If it is not available, there are set protocols between the medical director assigned to the jail and the officers to start, administer, and report on side effects for mental health medications or acute psychosis. And then not everybody has drug counselors. I will tell you, here at Clackamas County, this has been a position we have struggled with for years, 6, 7 years, is being able to retain our substance use treatment, substance use disorder counselors within the facility. Because as the outside environment changes, where a lot of our SUD counselors are doing telehealth work is available in jail settings, but it's very difficult to manage and maintain on a long-term basis. And so we lose a lot of our substance use disorder counselors to outside entities. We talked about crisis management. Part of crisis management is managing acute psychosis, and that includes medication management, the management of the housing of the individual itself. And unfortunately for jails, as healthcare providers, as mental health professionals, we understand the impacts that isolation and segregation can have on somebody who is in an acute psychosis. However, from a safety perspective, some of us may not have an option to not house an individual in isolation or segregation. Here in Clackamas County, we have limited options for somebody who is in an acute psychosis to house with other people in a manner that creates safety, not only for the individual in psychosis, but also the other people they're housed with, as well as the nurses and the deputies and the providers that are interacting with those individuals. Our providers and our mental health professionals work together to provide psychotherapy when that service can be provided. We try really hard to provide it in the cases that it's most needed, but it's not provided with every client. And then probably the most important thing that we do is maintaining medication compliance for individuals who have stabilized or who are not medication compliant to prevent acute psychosis. And that sometimes is a big job when you're, a team of 2 mental health professionals dealing with 330 some people. So this is an area where we love information from outside service providers. If you are a service provider and you identify somebody has been incarcerated, we like for you to reach out to us and give us any information that you are willing to share about how we can help this individual in our facility. And then it's really important to talk about a right to refuse. A lot of people think that when an individual comes into a correctional facility that we can just give them, their medications and we don't need consent from them. And that is absolutely untrue. The right to refuse is constitutionally protected. And because we as healthcare providers in a correctional facility tend to see a lot of malpractice suits and tort claims for various things, we have to be very particular about how we address a right to refuse. And that right to refusal can come from anyone in the facility, regardless of their ability to competently make that decision. We are not allowed to force medicate. In the state of Oregon, the only folks who can force medicate are the Oregon State Hospital and some of our acute psychiatric facilities, but only under specific court orders. Many of us have a process for withdrawal management in our facilities, where people get regular nursing assessments, they get medications, to abate the symptoms that are associated with withdrawal, whether it's opiate withdrawal or alcohol withdrawal. It doesn't really matter. We all have a process to take care of that. Some of us, many of us also have a process that uses some type of controlled substance to help manage the symptoms. So for alcohol, we would choose a benzodiazepine to help manage those symptoms. And then for opiates, we would choose, for most of us, we choose buprenorphine, which is absolutely the safest medication that we use. But some facilities who do not have access to buprenorphine, maybe they have T3 on their formulary, and that is what they choose to use in a taper method to help an individual overcome their withdrawal symptoms. However, medications for opiate use disorder is not currently available in all jails in Oregon. This is something that is actively changing. This is a very fluid situation in the state of Oregon's jails. We are working together on processes to increase access to medications to assist with alcohol and drug treatment. Things like buprenorphine, naloxone, methadone, individual counseling, group therapies. Not every jail has access to this. We here at Clackamas County have all of those things. We use chemical dependency counselors that are attached to a program called CSAP, which is a program external to the jail that does substance use treatment for individuals who are justice involved. It's a very good program. If you are interested in it, please Google it. It's CSAP, C-S-A-P, and you could get an idea of what the services they offer. But currently, not all medications for opiate use disorder are used in all jails across Oregon. And then finally, let's talk about release planning. So release planning can happen in a number of different ways for correctional settings, and it really just depends on how your facility is staffed and what your relationship is with your parole and probation division, your insurance carriers, and any outside care management organizations that are available in your county. So some of the simplest things we can offer is access to medication, whether that's a written prescription, whether we call a prescription into the nearest pharmacy that you or a peer or staff member go to pick up, or we have a process for access to physical medication that is in your property when you release. We, many of us try to make sure you at least have a follow-up with your primary care or your psychiatric provider, but that doesn't always happen. When we talk about individuals who are here for 7 to 14 days, if you are one person working with 300 people, you do not always have the ability to case manage, 20 people that might need services. And then there are those individuals that release without notice. And there's a number of different reasons why somebody could release without notice, and it happens every day. So some people may leave our facility without that appropriate follow-up. And if you happen to be that receiving provider, all you have to do is contact us. We are happy to send you the information that you need for an individual who has released to you, and we have the records that you are looking for. And then applying for insurance or reinstating insurance. So unfortunately, for all incarcerated individuals at this moment in time, their OHP is suspended while they are in custody. And we, as the in-custody providers, must attempt to have a way for them to reapply for their benefits or to reinstate them. So many of us have OHP assisters embedded within our jail, or we have partnerships with community organizations that will come in and do our OHP applications or reinstatement for benefits. If there's a chance you see an individual and you see their OHP is not turned back on, all you have to do is reach out to the county to find out who does that for the jails. It's a very simple form. It's called a 7100 form. It just requires us as the jail to provide some information. Even your own OHP CCHP assisters can do this. So if you have troubles with that, reach out to your county. You can reach out to OHA and see if you can find out who does that within your county for your jail. And then the other things we can offer if it's available to our county: housing, employment assistance, reinstatement of Social Security or disability benefits, helping individuals obtain a state ID. For many of the jails, we have an agreement with the DMV that if an individual brings their jail ID to a DMV appointment, along with some other information the DMV requires, they can use their picture ID from the jail as part of their photo identification process. So if you are a social worker and you are working with a client who needs to have their driver's license because they don't have a state issued ID, if they have their jail ID, that does work at most DMVs as a state issued ID, because we are a government facility and we do issue those ID. And there are checks to their identification that we do when we issue somebody a picture ID. When we're talking about housing, really, that is what's available in our county. Everybody knows housing is a huge problem across the state, not just in the Portland metro area or the Salem metro area, but across the state. There are oftentimes very limited housing options. So we will do our best to help an individual with housing where those resources lie, but sometimes those resources aren't available to some individuals. And so we do our best to navigate that system and help the individual understand how also to navigate that system. And then I will say release planning here at Clackamas County is primarily led by myself and a team of about 10 individuals between our parole and probation department, our medical department, our transitional services department, and our CSAP center. And so we all kind of work together. We all know different things about release planning. So my primary job is to make sure they have access to medications and that they have appointments. And I can delegate that to whomever on the team is available to do that. And then we have an OHP assister who can also delegate the task if she is not able to complete the task for somebody. And then we utilize our relationships with outside organizations to help with housing and employment, SSDI reinstatement, and getting state issued IDs. So that is pretty much everything that I have to say, adding on to what Myque said. I want to thank everyone for being here with us and listening to what we have to say about jails. I can't tell you enough, if you work in a county that you are needing to interact with your jail, Google it. Where is Deschutes County Jail? What is their phone number? Call. Ask to speak to the medical department, and then start your conversation from there. Because I promise you, all of us will be happy to have a chat with you, to send you medication information, to send you our last progress notes with an ROI. We are happy to make sure that those things happen, because we do know there are holes in all of our processes. And sometimes the best of intentions still allow people to slip through. And we call us. We're happy to reach out and do what we can. Thank you.
Fantastic. Melanie, wow, that is an incredible amount of information. And I myself find it really reassuring. I think we're hearing a lot of things from our presenters this morning that we normally just don't have insight to, and it's great. And it's reassuring just to know how many resources are out there and how much care actually exists that I think just doesn't get the attention it deserves. So I think this is incredibly useful and beneficial for everybody. So, and that's certainly the impression I get looking at the chat this morning. A lot of people are really engaged, and I think we're going to have a lot of lively questions later on.